Which of the following behaviors would be under the category grimace in the Apgar score? A. Coughing. B. Pulling away. C. Sneezing. D. All of these. The answer is D. All of these. The grimace category of the Apgar score actually refers to a wide variety of reflexive behavior. These include sneezing and coughing, crying on stimulation, pulling away, and facial expression. At what time after birth is the Apgar score calculated? A. At 1 minute only. B. At 1, 5, and 10 minutes. C. At 1 and 5 minutes. D. At 5 minutes only. The answer is C. At 1 and 5 minutes. The Apgar score is calculated 1 minute after birth, and then again at 5 minutes after birth. It is common for infants to be born with depressed respiration, cyanosis, and other physical signs of struggle that are quickly resolved within 5 minutes after birth. If signs of respiratory or cardiovascular distress do not improve by this time, however, emergency intervention may be required. You have just calculated a newborn's 5-minute Apgar score as 5. What is the proper response? A. Do nothing, this is a normal score. B. Emergency intervention, this is a severely depressed score. C. Do nothing, this is a perfect score. D. Monitor closely, this is a moderately depressed score. The answer is D. Monitor closely, this is a moderately depressed score. The Apgar scale goes from 0 to 10. A score of 0 to 3 would indicate severe depression of function, 4 to 6 would indicate moderate depression, and 7 to 10 would be a normal, healthy score. In the case of moderate depression, the newborn should be monitored closely. Immediate emergency intervention may not be required, as healthy neonates can have moderately low Apgar score indicators that improve in the first few hours of life. What is a normal heart rate for a newborn 2 hours postpartum? A. 110 to 160 beats per minute. B. 60 to 90 beats per minute. C. 140 to 190 beats per minute. D. 80 to 110 beats per minute. The answer is A. 110 to 160 beats per minute. A newborn's heart rate is significantly higher than that of an adult. Normal heart rate for a newborn 2 hours postpartum is 110 to 160 beats per minute. Heart rate decreases in the first year of life to 80-140 beats per minute. A nurse assists in the delivery of a healthy 7 pounds, 4 ounces infant. 6 days later the parents call the clinic with some concern. They state that their daughter has begun to lose weight. She has lost nearly 10 ounces since birth, despite breastfeeding regularly. How should the nurse counsel this couple? A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. B. This is an emergency. The couple should bring their infant to the emergency department. C. This is not normal but not yet a cause for concern. D. This is abnormal and cause for serious concern. The answer is A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. It is normal for infants to lose 5 to 10% of their birth weight in the first 7 days of their lives. In a healthy baby, This weight will be regained by the end of their second week. Infants who are born ill or premature may take longer to regain this weight. If an infant has passed the second week of life and it has not returned to or surpassed its birth weight, the family may need to seek lactation counseling or bring the infant in for further evaluation.